Let's talk about one of the most important nerves in the entire body to help you with chronic pain and stress. And that's the trigeminal nerve. That's cranial nerve number 5 out of 12 cranial nerves. It's the largest cranial nerve that you have, and that takes a beating, honestly, when you've had anything done to your teeth or had jaw trauma. So have you ever been to the dentist and you have a cavity or you need to get some work done and they stick a big giant needle in there? Well, they hit the trigeminal nerve because that's the sensory nerve to the teeth and the face and that jaw. So they numb it, they can get in there and do their thing, but that also traumatizes the nerve. So that'll send signals from the nerve back to the brainstem where it resides, and then that can cause issues later on like pain or increase in stress. The place that you can access the trigeminal nerve is in the face. So if you look at this picture here, that's going to show you the facial exits of branches of the trigeminal nerve. You can see one is going to be right next to the cheek here and the nose. The other one is down on the chin, and the other one is above the orbit of the eye. And if you look, they form like a straight line on each other. So if you touch those places, it can be really, really tender. If it's really tender there, that means the nerve has inflammation and you want to work it. So you have a left trigeminal, you have a right trigeminal, but you always want to work both sides. I'm going to show you some options that you can do to help these areas, and you see which one might work best for you to make a difference and you feeling a little bit better and not suffering so much. And then here's another representation of it as well, where you can see different parts of the face and the jaw that are supplied by the particular branch of the trigeminal nerve. You've got the mandibular V3, this is for mandible. Then maxillary V2, which is the maxillary region, makes sense, right? And the ophthalmic up here for eye. So take a look right here of the skull. That's one right next to the nose. This is on that chin. And right here above the orbit of the eye. Like, these can be really, really tender. So that's a sign that you should be getting in there a lot. One of my favorite things to use are our vagal rounds. So we use this on vagus nerve spots to stimulate the vagus nerve, but you can also use it on the trigeminal nerve. You just take them, peel them off the paper, and you place them right over those holes. So this is on the V2 branch. I'll do the same thing on the other side. This works great because it helps the blood flow to the face, and it goes right over a lymph node that gets clogged there a lot, and that can give you sinus issues, issues on the skin where you get redness or puffiness or acne, stuff like that. It'll also help drain underneath with these bags under the eyes. You can wear these at night when you sleep, take them off in the morning when you wake up. And if you want to do the other branch, you just draw a line straight down. Right there on the chin, you got the V3. That one feels really good if you have any teeth work down on the lower jaw. And then, oh man, that feels really good actually. And if you want to go powerhouse like monster mode, you can do the one up top. You just have to be careful like of the eyebrow there, right? So it goes here. And if you put these suckers on you at night and go to sleep, you'll probably sleep much better. And because the trigeminal nerve will help you relax. And it'll start to drain the face. So you wake up with a more youthful looking face. So you can do this one, or you can combine it with the other stuff that's coming up next. Let's talk about a few other things you can do to these 3 places on the face. You can actually tap them. Nice small little taps 5 to 10 times. Some people like to go 15 to 20. You can do one side at a time. If you like, you can do both sides at a time. It's up to you. Whatever feels better. Just don't cause pain when you do it. You can also use red light. Now, I don't have one with me here, but there's a lot of red light devices out there that you can use, and you can just place that right up against the face, and that will also help stimulate and relax the inflammation around the trigeminal nerve. I also like to use tuning forks. I don't do any particular type of frequency. This one is called a biofield tuning fork, known as a sonic slider. And if you just tap it and hit it, it vibrates. Then you can place that on each one of those spots. That feels really, really nice. I do this quite a bit to the patients in my office, and they really like. Ooh, that feels quite nice. And you can do a vibration ball. So this is our Mojo vibration massage ball. If you click that on, and it has different speeds. I think I've shown this on a prior video in the past because it works really well. You can hold the ball, take a finger off, and the finger vibrates. You can place the finger on each one of those individual spots, and that really vibrates the nerve quite nicely. And if you want to go even more vibration, you can just lightly put the ball on that part of the cheek, and that'll get it quite well. I think I'll do that on this one today. This is good for opening up the sinuses. If you're congested in your sinuses here, because you have a frontal sinus in this region, that's so good right there. Wow. It'll help those drain. Get all that stuff that's stuck inside of here out. Then this is when people ask, well, how often should you do these things? I wish I could tell you a specific one, but it's a little bit different for everybody. I will tell you that when you're dealing with nerves, more doesn't mean better. Better means better. So go in easy. Just try it once a day, see how you feel. And then every other day works quite nicely for a lot of people. See how you feel. Maybe you like to do it every single day. Don't overthink it. Just feel first. Notice what your body tells you and just go by that. I hope this was helpful for you and you learned a few things that you can do to help yourself feel less stress, less pain, especially if you've had anything done around the teeth or the jaw with dental work or trauma. This is Dr. Perry from Stop Chasing Pain. Thank you so much for tuning in. Please give us a follow, like, and subscribe. We're really grateful. We'll see you soon on the next video. Have a good one.